We're going to go on to Rachel Russell of the Royal College of Occupational Therapists. She's an academic, a proud Yorkshirewoman, and author of the Adaptations Without Delay.
Oh, thank you. Thank you very much for the introduction. Yes, I am a very proud Yorkshirewoman, and you probably can tell from my accent that I am indeed from Yorkshire. I'd say thank you. I'm here. I've got two hats on. Obviously, I'm an academic, and I'm also representing the Royal College of Occupational Therapists this afternoon. I appreciate we're tight on time, so I will try to whiz through the presentation as quickly as I can. As a member organisation, we represent over 33,000 occupational therapists that practice across the 4 nations. And what I want to do this afternoon is just to give you some insights in terms of how we as occupational therapists have weaved technology into our practice, and the opportunities that's given us to reflect on how we currently deliver the services that we do to older and disabled people, and the opportunities that technology has in terms of actually improving the way that we assess and deliver housing adaptations. So what I'm going to do over the next few slides is just kind of talk about how our members have responded in their daily practice to COVID-19. I want to talk a little bit, obviously being an academic, I would talk a little bit around some of the positive evidence there is out there in terms of the use of technology to support the way that we work as occupational therapists and health and housing practitioners. Talk a little bit around the reflections of what we've learned as a professional groups in using this technology in practice, and also just link at the end to Adaptations Without Delay. Paul, have I got control of the presentation?
Yes, you should have. Yep.
Yeah, okay. Can you just go, I don't know how to go back. Could you just go back for me, Paul, to the beginning? Beginning slide, thanks. I'm sure I've put this photograph up, and I'm sure there was probably a collective groan from the occupational therapists out there. But before I kind of go through the main slides, I think this slide is really important for me, because I'm actually very proud to belong to a profession where the principles of what we do and the evidence base around what we do in terms of improving health and well-being is actually based around enabling people to do the everyday activities that give them a sense of meaning, belonging and purpose. And obviously this is a picture from occupational therapy 100 years ago, working with those returning from the First World War, giving people a sense of meaning as they recovered. And I think, in a way, for occupational therapists, I think what COVID-19 has done is actually given us an opportunity for you, the audience out there, to have a crash course on what it is to be an occupational therapist and the mindset that we have as occupational therapists. I think if you think about the changes that we've had to implement through social distances and all the other measures that the government has brought in, and if we think about the impact that has had on us as individuals, as community, and wider society, I just want you to kind of reflect on your own lives over the last 3 months, in terms of it's given you a taste of perhaps not being able to do those everyday activities that you would normally do. It's had an impact on that you're not able to do those activities perhaps where you want to do them. You perhaps not doing the activities in a way that you would typically do them, and also that it's had an impact on as I say, how you do those activities. And I think what's really important is just reflecting on the impact that has had on your own health and well-being over the last 3 months. Now, for myself, and I'm sure for some of you sat there, for me since March, it's very much felt like, because we've not been able to do all those everyday activities that are important to us, it's very much felt like we've just been existing and not living. Now, fortunately, as we move through easing up through lockdowns, the majority of us will just be able to adapt and kind of get back to where we were before. But I think this is an opportunity for us as practitioners to really get a sense of actually how it will be for those individuals who aren't necessarily going to be able to adapt to their the impact that COVID-19 has had on them, or for those individuals who are aging or have got disability. And I think it's about remembering the important role that Adaptations has in terms of creating those spaces, those home environments that enable us to get back, or enable us to have those environments that help us to do those everyday activities. And I think what I'd like us to do, and I think this is an opportunity, is for us to really reflect around how we strategically, operationally, as individual practitioners, occupational therapists, housing, how we actually kind of view adaptations, and how, particularly around the DFG, and how we interpret what's necessary and appropriate, what's reasonable, practicable, because these elements really have an impact on the type of adaptations that we design. And I think it's about us really kind of resetting and reflecting, are we designing spaces that just support people to exist, or is this a real opportunity to sit back and reflect and create spaces that you know, that enable us to live and not just exist. So that said, just in terms of, we're a very adaptable profession, and this is just an overview of how we've responded to those changes that have been brought into practice due to social distancing. So as practitioners, we've had to really think about that. Obviously, we're not being able to do direct, in many cases, direct face-to-face assessments and face-to-face delivery of rehabilitation and interventions such as adaptations. A lot of the technology that's being used was already being used by occupational therapists. So some of this won't be new to you out there in the audience, but I think what it's highlighted is the usefulness of this technology in supporting our ability to be able to work with older and disabled people. Obviously, we've seen an increase in the use of telephone assessments. We have now got practitioners that are using the various teleconsultation and telehealth platforms to conduct environmental assessments. We're using the same teleconsultation platforms to provide advice, training for carers, and checking of equipment, looking at recommending minor adaptations. We're natively things like Google Earth, Google Maps, so that we can use that virtual technology to help us do external environmental assessments that we perhaps would have done face. We've got practitioners that are developing instructional videos that help to explain how to use some of the equipment that we're providing, some of the minor adaptations that we're providing. So we, you know, creative occupational therapists that are doing that in terms of designing and developing instructional videos. And I think one of the great things has been around the use of technologies such as Microsoft Teams, Skype and Zoom to facilitate collaboration between ourselves as occupational therapists and our housing colleagues in terms of the delivery of adaptations. One of the important roles that we've had as the Royal College is obviously we're having to adapt our practice really, really quickly, and what members have wanted are obviously wanting to change practice so that we can continue to meet the health and wellbeing needs of the people that we work with. But it's also ensuring that this new way of practicing is ethical, it's safe, and you know, it delivers, it has an evidence base. So one of the jobs that I've had is to actually look at that evidence base, and I've done a little bit of a review of the literature and the evidence, and I just want to share a little bit around what we found and how the evidence actually really supports these new ways of working in terms of using technology alongside our practice. So just to cue you in what I'm talking about when I'm talking about technology, it's very much around the telehealth and telerehabilitation conversations. So the application of teleconferencing platforms and those types of things. I just wanted to put that there so you knew in terms of the evidence base that what I'm looking at. before I just kind of talk about some of the really positive things that have come from the evidence and around using telehealth, it's just, as obviously as an academic, it's just about putting a bit of a caveat in terms of how we should be evaluating some of this research. It's about acknowledging that a number of the studies, there are about 6 or 7 studies that have specifically looked at the use of telehealth, telerehabilitation in occupational therapy and housing and social care. But as you can well imagine, these are very small scale studies. In other areas of occupational therapy, there have been larger studies, but certainly within housing, these studies are very small scale. In terms of, from an academic point of view, from a research point of view, if you were to evaluate the quality of the methodologies to the approach used to do the research, there could be some criticisms made around the methodologies, but I still think that the findings still provide us with some useful insights and evidence to the effectiveness of using technology. And I don't think anybody will be surprised, but most of this research has come out of the US and Australia, but that this is an opportunity for us in the UK to develop our own evidence base around using telehealth, telerehabilitation in the delivery of housing adaptations. So that's just a little bit of a caveat around what the positive stuff I'm going to mention now. So in terms of the research, in terms of how the technology is being used, it's being used synchronously. So that's where you are using the technology, teleconferencing, as I am doing now, live with the person. It's also being used asynchronously. So this is where perhaps like with the videos, providing videos for providing treatments. So that's asynchronous, where you're not directly with the person in real time. And also some projects where both are being used. In terms of what technology is being used in terms of the research, so research has very much looked at the use of teleconferencing, teleconsultation platforms, the use of photographs, or a combination of those ways to use that technology. In terms of when it's used, in terms of supporting practice out there, it's being used as an audit tool, so particularly photographs. Some of the teleconferencing platforms allow you to use your mobile phone or your tablet to walk around the home. So that is being used as an audit tool, as an assessment tool, to look at perhaps some of the environmental barriers that might be posing or maybe having an impact on health and well-being. It's providing, once again, using teleconsultation platforms. It gives the occupational therapist, from a remote perspective, an opportunity to observe the person in their environment, observing the person interacting in their environment. Again, that helps us get an understanding of actually what the issues are. The technology is being used in terms of supporting the design of the adaptation, and also one of the things that we often have an issue in this field of practice is being able to go back and actually look at how the adaptations have really impact on health and well-being. So it's being used to measure outcomes as well. So in terms of what the evidence says, which hopefully will be some reassurance to those practitioners out there who's already using this technology, is that the results show that it's promising. It's promising in the sense of, and this won't come as any surprise, but just basic things like obviously not having to travel. So colleagues who work in remote parts of the country, rural areas, reduces that travel time. It provides, you know, we're trying to be much more person-centered, so it provides, the use of technologies about providing flexibility around how we work and how we work with the people that require adaptations. It helps make better use of expertise. Occupational therapy, it's great to hear that we want more occupational therapists, but we are a scarce resource, and the use of this technology actually helps us use that expertise much more effectively. It's also been shown to be effective as well. So when they've compared the use of teleconferencing platforms with direct face-to-face, the actually being with the person, the outcomes are basically the same. What's really reassuring is that the use of technology, practitioners tend to be overcautious, so tend to over-prescribe rather than miss issues. I think there is a need in terms of training, so it's not just about, and I'm sure this theme has come through, it's not just about dishing out the technology, using the technology. It's about providing the training, upskilling the therapists, upskilling the people that we're going to be working with and using the technology, and the carers. The evidence also kind of says that I think there is a fear from practitioners that the technology isn't going to be acceptable for service users, but the evidence coming through shows that actually this technology, the use of teleconferencing, is for some service users, some users really valued, and makes them feel much more part of the adaptation process. I think once again linked with training is the need to develop policies, practice, protocols around the use of technology, and having protocols such as triage tools, assessment tools that actually support remote ways of working. One of the really interesting things that did come through was the importance of actually using teleconferencing to observe that interaction of the person, not necessarily around the assessment of need, but certainly around understanding what's going to be the best design of adaptation. Actually observing the interaction of the person was seen as really important. So just to quickly, just some real quick reflections. I think this is a real opportunity to look at what technology is out there and really think about how we can use this technology to enhance practice. Technology is not going to be the right solution for everybody, but it's about identifying those situations where this technology is really going to be able to enhance our practice, how we design adaptations, how we deliver adaptations. It's about ensuring that we again, just repeating myself, how we provide that training, the policies and procedures, and that we need those things in place, and we need to have those discussions. Again, how we use that technology alongside assessments, and I think that's one thing that we're learning as practitioners is around actually how can we use this technology to enhance what we're doing and alongside our current practices. I think what's really important when using these technologies for remote working, et cetera, is that we provide really good information to those that we're going to be working with, their carers, so that they're really able to give informed consent as to that this is the way that they want to work, that they want to use this technology as part of their as part of the process of working with them. One of the things that's really important as well, I've just rushed through this, sorry, I appreciate I'm taking a lot of time, is simulation. So those, I will, honestly, I've just got one more slide.
Brilliant.
Is the need to practice. So if you're going to use this technology, actually practice on each other before you actually use it live. One of the key things is that the Royal College has lots of resources for practitioners, because this is a new way of working. We want to make sure that our practice is safe and ethical. So you've got your HCPC standards of practice and the RCEOT Code of Ethics and Professional Code of Conduct. That is there to help you think about how you're using that technology to support your practice. Really quickly, I think what's encouraging and what's been really encouraging to hear from everybody else speaking is the important part that housing is having in terms of post-COVID-19 and how we're looking at rehabilitation. And the need to look, this is my last slide on us, so the opportunity to look at different ways of working. The Royal College with the housing link published the Adaptations Without Delay, and I think using technology, this is a really useful and timely way in which we can use the technology to ensure what we're doing is being more responsive to those that we're delivering adaptations to, that we're using this technology to make more effective use of occupational therapy resource. We're using this technology to look at how we can redesign services so that we can be much more effective at delivering adaptations in a much more timely way. The Adaptations Without Delay document is a fantastic document and a starting point in organisations looking at how they can redesign so that they're delivering services in a safe and person-centred approach. But it's also about ensuring that when we're looking at adaptations, it's about prevention, ensuring that we're getting investment. If we're going to be using this technology, that there is the investment there around enabling that change and training of education of both practitioners, but also the people that use our services as well. So I'm sorry I spoke at a fast speed there. There are some references as well, and I can circulate the references if people want to have a look at that. So thank you very much.
Thank you very much. That was really interesting, especially
Right.
all those reflections and some of the evidence that you've already gathered. We've got a poll to wrap up that presentation again. This one is, what do you think the long-term effect of COVID-19 will be on practice in housing and social care? Will we do things very differently? Will there be some minor changes, or things will return to how they were done before? And then we've got a couple of good Q&As to do. So do make sure that you keep up voting, which is pressing the little thumbs up sign on the questions that you want to hear answered.
Okay, the votes are slowing down, so I'll close it in 3, 2, 1. And there's the results.
Results definitely take a little bit of time to show on my screen, Paul, so I've no idea what they say. I'm hoping people are reasonably optimistic, yes, and also ready for lunch.
Yeah, 5%, only 5% of people said we'll return to how we did things before.
Well, that's, there we go, it's arrived for me.
Just over 5% will do things very differently.
Brilliant. We've got a couple of minutes to do a couple of questions. So we had one with several upvotes, but originally asked by an anonymous person for Paul, around whether the TSA is going to produce standards so that providers know what they should be looking for when speaking to manufacturers in relation to the switch over from analogue to digital for care alarms.
So I've partly answered this already in the Q&A, but there's quite a lot of materials, guidance and information on the TSA website, including some videos for frontline workers on the digital switch. And we're working with Ofcom and with the telecoms infrastructure providers to make sure that there is testing of existing equipment so it can be run on a digital network. So there's quite a lot going on in the background. There'll be more information coming from TSA on that in the near future.
Thank you very much. And one more for you around whether tech can reduce the need for care home admissions, and if so, by how much? They acknowledge it's a difficult question.
Yes, it is, and it depends on where your starting place is as well. There isn't, I think, much published detailed research, and certainly no randomised controlled trials on this. But what I think we can say is that there is an increased use of plug and play types of technology to facilitate safe discharge back to home. We're seeing that particularly as an innovation during the pandemic. Which I think we'll be looking to see how that has worked out, and whether it's something we adapt and adopt, or whether it's something we abandon as we come out of the pandemic. And certainly I think there is an opportunity to slow that progression of need. I whizzed past the slide about slowing progression of need. What that slide showed, and people can look at it later, is all the different technology-based interventions. But I just emphasised, as an organisation, we're very clear that technology is not itself the solution. The way you redesign the service to leverage the technology, and how you put the person at the centre of the design.
Thank you. And we've got just one more. I know it's past, but Paul and Rachel and possibly Beatrice, if you're still there, you might have thoughts on this one. What more can be done to support people who do not have digital skills or access to the services, especially rough sleepers and the elderly? And that comes from Angelina Barnett.
Do you want me to start?
Yeah, please. Thank you.
Leap in. Sorry. I mean, I think this comes back to my point just now around person-centered design. We need to make sure that the sorts of ways in which we're using technology are ones that are designed in a very intuitive way, are designed with people with a base of lived experience in the first place. there is a digital divide. I think that's been exacerbated during the pandemic. I think one of the areas of public policy that does need to be examined going forward is how we make sure, whether it's in mental health, whether it's in social care, those that are furthest away from access to digital actually have that, so they can benefit from some of the obvious impacts that are available to them through technology.
Thanks. I don't know if you have anything you want to add in as well, Rachel. Or Beatrice?
Hi, yeah, I'm still here. I mean, I need to add, yeah, absolutely, there's a digital divide, but I suppose to, again, on a slightly more positive note, we have managed to move our recovery college service, which is a kind of informal learning service for people to provide them with something, with activities to support around basic skills, including digital literacy skills, but also to provide them with activities and networking, so they don't feel isolated. In normal times, that service exists. We have managed to move that online, and we've had really good participation. So I think it's also really important that we don't just kind of automatically exclude people from digital solutions without testing it first as well, because actually we've had some quite positive experience with involving our clients who are sleeping rough remotely and digitally.
Great, thank you. And we've also got some good points on the chat about communities with limited digital connection generally, and some wider issues such as providers. But we're going to wrap that session up there. So thank you very much to everybody who's contributed